Alright, my name is Tracy Johns, and this is my informative speech. This is my audience.
Hi.
Thank you. Are you pregnant? The question may be more difficult to answer than you think. You can have all the signs of pregnancy and not be pregnant, or you may only have a few and be definitely pregnant. Common signs to look for are frequent urination, food cravings or aversions, fluttering sensations in the lower abdomen, fatigue, nausea, and headaches, and maybe the absence of a menstrual cycle. If any of these symptoms apply, then the probability is high. However, they are not the only deciding factor for determining whether or not you're actually pregnant. A pregnancy test is now needed. Pregnancy tests are available in all shapes, different sizes, prices. According to author Betsy Gallup of the Love to Know Corporation, home pregnancy test measures the human chorionic gonadotropin hormone, known as HCG hormone. This hormone is only found in pregnant women because it is only released when the fertilized egg attaches to the uterine wall. In order to obtain the most accurate reading, follow these simple guidelines given by Robin Elise Wise, LCC, with About.com. Wait until a week after your menstrual cycle is missed. Do not use an expired test. Use the test immediately after opening. Use the first urine of the day, as it contains the most HCG. And wait the full required time for your answer. Okay, time's up. You're pregnant. There are many changes your body and baby will be undergoing. The biggest common concern that you may have is weight gain. According to Baby Center Medical Advisory Board, if your weight was healthy in correspondence to your height before you were impregnated, then you should gain between 25 and 35 pounds. If you were underweight, then you should gain about 28 to 40. If you were overweight, about 15 to 25. And if you're expecting twins, add an extra 10 pounds. Keep in mind, every woman is different. Dr. Richard Aubie, Heidi Murkoff, Arlene Eisenberger, and Sandy Hathaway tell you what symptoms you can expect each month in the book What to Expect When You're Expecting. However, keep in mind that all of these experiences and symptoms may not occur to you. Every woman in pregnancy is different. The first month begins the first trimester. Your embryo is not even a grain of rice. There is a head, but arms and legs have not yet fully formed. You are likely to be feeling fatigue, nauseated, frequent urination, and food aversions or cravings. The second month, your embryo loses his tail, and organs are present but yet not fully formed. You may be experiencing occasional headaches, dizziness, as well as morning sickness, which can occur in the morning, afternoon, and night. The third month, your baby becomes a fetus and is the size of an apple. The eyes and ears are moving into place, and the gender can now be known. The heartbeat can even be detected on a Doppler. Your uterus is the size of a grapefruit now, and you may have excess salivation, as well as some or all of the previous month's symptoms. The fourth month begins your second trimester. Temporary hair called lanugo is forming over the baby's body. He can suck his thumb now. Although your clothes may not be fitting, you'll be very happy to know that morning sickness is usually beginning to subside this month. In the fifth month, the skin is pinkish and covered with a greasy white substance called vernix to help the baby when the baby exits the birth canal. Weighing almost a pound, your baby is packing more in his punches. You may also be feeling nasal congestion, leg cramps, mild swelling of the ankles and feet, but don't worry, you're halfway through your pregnancy now. In the sixth month, your baby is a foot long and weighs close to 2 pounds. He can grasp the umbilical cord and even pedal his feet. Your uterus is the size of a basketball, and mood swings should be coming to a halt soon. Look on the bright side. Your breasts are likely increasing in size. As you begin the 7th month, you enter your third trimester. The lanugo is beginning to shed, and the head hair is starting to grow. Lungs are beginning to work now, but they're very immature still. The 8th month, your fetus weighs 5 to 6 pounds. And just like a newborn baby will experience REM sleep and active wakefulness. The lungs are approaching maturity. You may be having backaches, leg cramps, and increased constipation. You're very likely to be having difficulty sleeping and an increase in Braxton Hicks contractions. Here is an example of what an 8-month baby looks like. The 9th and final month of pregnancy can be the most uncomfortable for you and the baby. Baby is getting ready for his special day. The umbilical cord is over 2 feet long, and baby has pretty much reached his full weight. You're likely to be experiencing intense backaches, itchy abdomen, increased clumsiness, waddling, and an increase or lack of appetite. Now that you have almost reached the finish line, there are several signs of labor you need to be aware of. According to the author of Women's Health online website, these signs are period-like cramps, blood stain, and of course contractions. Once you are in labor, you will go through 3 stages. The first stage is usually the longest and could last for days or weeks. In this stage, your cervix begins to dilate and your contractions grow stronger. The second phase is the more active phase of labor and is accompanied by the actual delivery of the baby. This is the time in which your water will break and your cervix will completely dilated. But it's not over yet. After you deliver the baby, there's a third stage. This is when the uterus shrinks in size and the placenta separates from the uterine wall. The delivery of the placenta is known as the afterbirth. Although you may be too tired to continue on, it is vital to your life. If you do not continue on, this could lead to profuse bleeding and loss of life. But don't worry with all the pains that you may be experiencing through pregnancy and childbirth. You've just given birth to a baby, a healthy, beautiful baby, and that's one of the greatest joys of life, and so many people take it for granted.
Thank you.
Oh my God, I hate speeches. I hate them.